Hi, and welcome to this week's video podcast. I'm Brent Dodge, and I have with me Kristi Moore, physical therapist, one of the two physical therapists at Alpine who are working towards specialization in the dance medicine field. So we have a lot in store for you today as we begin to understand what dance medicine is from a physical therapist perspective. I'm hoping, Kristi, you can help me just get an idea what is going on with the dance medicine program.
So dance medicine is an overall approach to working with dancers starting from an injury prevention standpoint, as well as comprehensive care for those dancers who have an acute just injury strain that they've recently received to something that's been more of a chronic condition, as well as maintaining their functional mobility for them to be able to continue dancing.
So it sounds a lot like, I've been a physical therapist for over 20 years and have had a great opportunity to work in sports medicine, looking at sports injury, looking at sports performance. Mm-hmm. It sounds like it's kind of hitting on both sides of the equation, both the prevention of injury, rehab of injury, and then maximizing performance.
It definitely is. Dancers by far are considered athletes throughout, everywhere. They put their bodies through the same types of things that any other athlete would do. But in addition to that athleticism, they also have an artistic quality where they've got to be able to move through extreme ranges of motion, have control, so that they don't create an injury in there. So there's a little bit more of that fine-tuning and really being able to pick out where they're having an issue with something and being able to make a difference to help them not have an injury or have something that would be a lifelong or a chronic thing that they may have to deal with down the road.
Well, I know you have a lot of experience as a physical therapist working with athletes and so forth, but the fact that you've kind of gone the next mile to get and work toward this certification, how does one do that?
Well, the way that we started is, we became interested in doing this and started looking to figure out where was going to be the best route to go. And there's not very many places where you can do continuing education for physical therapy. It's primarily in New York City because that's where the majority of dancers in our country are. And how we went about choosing is we looked at kind of the history of PT and who's been doing this. And there's a particular woman, Marika Molnar, who was the first physical therapist to ever be hired by a professional dance company with the New York City Ballet. And she's been working with them for about 30 years. And she has her own practice in New York, and she has the program that we're going through, which is a dance medicine certification.
And you and Angela have both gone for like a 10-day stint at one point, and will you go again for a follow-up then?
We will. We'll be going again the end of May, beginning of June, to finish up the last of the classwork. And then there's a little bit more work that will happen after that for us to receive the actual certification in dance medicine.
So really it's one thing for, a good physical therapist to maybe work with dancers, but this sounds like it's taken it to a whole new level.
It definitely has. Through this continuing education and this training, we get to observe professional dancers. So we get to hear the PTs who are working with those professional dancers, what they're seeing, and we get to learn about, the specific motions, the names for all the things that dancers do. We get to learn the anatomy that's involved with some of those movements and where they should be getting that motion from, the muscle groups that they really need to work on, and how they cheat and compensate, because we all do that at certain times, and dancers are not an exception to that, and that's how injuries can occur. So it's really combining the education and anatomical thing with the observation piece and learning how to be able to detect when there's a potential problem, or if there is a problem, why that's occurring with the dancer.
That is tremendous. My question, I wonder for our listeners, where does one go? Like, when do they decide to come and see you? Should they wait till they're injured? How does all that work?
There are many options. Obviously we would love to do injury prevention and prevent a dancer from being injured, because when a dancer's injured, it can be fairly significant as far as the impact of what they're able to do from a dance perspective. So by all means, injury prevention. Angela and I are both, we have tremendous experience in looking at movement. And so when we watch somebody do something, even if they're not injured, we can tell if they're getting that motion or that specific movement that they need to do from the correct places, or if they're weak in a certain area and we need to work on strength, we can help to do that before there's an injury. Definitely, if there's an acute injury, as soon as possible, come in and see us, because we can get that taken care of, we can get it calmed down, and we can figure out why it's happening and change it and get you either back to dancing or have you continue dance while we're working on things. And even for those folks that have a chronic condition, because we've seen some older dancers that were dancers when they were younger and maybe even aren't dancers anymore, that have some of those movement patterns that have led to, you know, some issues that they're dealing with. And so we can also help with that because we understand the motions that they've been putting their body through for years, so we know how to address that and help to improve it as well.
So if you were to watch a majority of dancers, is there a potential that you know there's some of these cheats, some of these compensations that you'd be picking up that could be amenable to the types of treatments and exercise movement specialization that you guys do?
Yes, definitely. I've watched dance for a very long time, not only with professional stuff, but in watching kids, and that's a lot of what we see right now. We see some of those older dancers, but also a lot of the adolescent dancers. And I think in watching them and seeing that enough and observing and kind of knowing the muscle groups that are supposed to happen, looking at those young dancers, looking at the professional dancers and the difference in how they get that movement, it helps you to be able to figure out what they need to do to make those changes so that they can grow into beautiful dancers and not have injuries throughout their careers.
So again, the injury prevention side, rehabilitation after an injury, and then this idea of improving performance, maybe by picking out those ideas, working on those in the clinic or on site. What other aspects of performance are you working on?
You know, we're working to get them to be efficient with their motion, protecting themselves, learning how to utilize their core while they're doing something with their arms. You know, we're really looking at all the different aspects of what they need to do. And we also are offering a dancer conditioning class because in conjunction with knowing that they need to have a specific kind of strength, you know, if all they do is dance, you know, that sets anyone up, whether you're a runner, if that's all you do is run, you know, you're setting yourself up for an injury. So you have to balance the strengthening and know what kind of strength the dancer needs. So we've also come up with a dance conditioning class that we offer for the young dancers so that they can get the appropriate kind of strength.
That is fantastic. Now you've had an opportunity to really put this into practice by being on site at the recent Garden City Ballet, the Nutcracker, and that was just this past week or so. Tell us about that and things you ran into and things you were able to help with.
It's very exciting. It's very fun being backstage. There's always things going on back there. Yeah, there's injuries, you know, those are the acute type of injuries from just that, you know, overuse, like they've been rehearsing all week on a hard surface. They're doing 6 performances, 2 per day. Some of those children are as young as 5 up to the professional dancers that are in their 20s, and things happen. Things start to get strained. Over this past weekend, I probably worked with over 20 dancers. You know, everything from just a question to, I'm having shin splints, what can I do with this? You know, what would help so that it won't be as painful? To serious, significant muscle strain and a rolled ankle. You know, there's just a lot that happens. The younger dancers, it tends to be more in the feet and ankles usually, sometimes the knees as well, so kind of that lower extremity region. This weekend I didn't see anybody too significant as far as like back and hip, but often when we see older dancers it tends to get up the chain, like they've already got the strength in their legs, they've been doing it for a long time and the muscle memory is there. That being said, they still can get injuries in those areas too, so this weekend it was definitely a lot of knees, ankles, feet, calf muscles, that type of thing. So a lot of ice, taping up, working on massaging, giving some advice of things to look for this next week.
Sounds like you were in your element.
Yeah, I hope so.
Very cool.
Yeah.
We're excited about the dance medicine outreach and just really excited about what you're doing, what Angela's doing in that field, and looking forward to that kind of next leg when you guys go back to New York and complete your work. I think it's a real help to our area dancers and just want people to know what you guys do, because really I think a lot of us don't understand what it is that you're bringing to the, you know, that sport, if you will.
Okay.
So thanks for doing that. Thanks for being with us today. Hang tight, we're going to do the tip of the day.
Alpine Physical Therapy introduces dance medicine and rehabilitation, reaching out to Missoula area dancers to help with injury prevention as well as rehabilitation from dance-specific injuries. Physical therapists with specialized training to work with dancers of all ages and genres. Alpine Physical Therapy, supporting Missoula's thriving dance community. dancer who's experiencing any form of an injury or having some aches and pains, definitely schedule an appointment with Alpine Physical Therapy. The sooner you get in, the sooner that we can get you back to dancing or potentially continue to dance. Hopefully we're going to prevent you from heading into a path where you might have to take a break from dance or any type of a chronic issue. Oftentimes people wait too long before they come in to see us, and then it becomes a much bigger deal and it's going to take longer for you to get back to your dance. So if you're experiencing any of these issues, please don't hesitate to give us a call at Alpine.
We hope you've enjoyed this informative podcast on dance medicine. We sure appreciate Kristi Moore being with us. Again, if you need to contact our office, and we encourage you to do so, Kristi and Angela work out of our North Clinic, 541-2606. And be sure to visit alpineptmissoula.com, click on specialties, and you'll find the dance medicine webpage.